Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Do subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Two Talk, I have Dr. Ravindra Savadi. To give you a brief introduction about Dr. Ravindra Savadi, Dr. Ravindra Savadi has been a professor of prosthodontics and practices exclusively at Savadi Dental Care. He has just completed his tenure as the president of the Indian Prosthodontic Society. He's a graduate from the VS Dental College and did his post-graduation from the Government Dental College, Bangalore. He has over 31 years of experience in clinical dentistry, and he has been very active with the Indian Dental Association for the past 30 years. He has held the position of the president of the IDA at the national, state, and at the branch levels. He has been a member of the board of the PG studies of the Rajiv Gandhi University of Health Sciences. He has been a keynote speaker and a guest speaker at several conferences all over India. He was awarded the prestigious S. Ramachandra Oration Award by the IDA Karnataka State Branch in the year 2010. On Sir's request, I have actually concised his entire introduction. I hope that does justice to all his achievements. Good morning, sir, and
Good morning.
it's another Two Talk conversation.
Good morning. Thank you for the introduction.
How are things now? Now that we are in a lockdown period, and considering I think we dentists are not actually practicing right now. So, what exactly would you like to tell our patients in this current scenario?
So, good morning once again, and thank you, Rekha, for having me with you and allowing me to share a few of my thoughts with you and your team and generally everybody. Um, so, current scenario, like you're all aware, the lockdown is on, and we are in a quite a big crisis, a world crisis. Though it looks scary at the outset, we all need to be confident that and hopeful and as bright and smiling as what you are, and generally look for the best. And I'm sure the best is going to happen. It is just that it is going to take some time for this thing to pass, and this too shall pass. So, keeping that in mind, we should be positive and think positive and go ahead positively.
So, sir, since now the government has extended the lockdown to another 15 days, say till the end of the month, I think till May 3rd. Uh, as dentists, do you think we will be able to start our practice in the immediate future like that?
Now, this is an unprecedented situation. We really have no history, no evidence, nothing about this particular virus. Even today, I read some snippet shared by a friend of mine from doctors in Pune who were saying that the patient was laughing and talking happily, and within a few hours later, he was dead. So this is one extreme, of course. I'm not saying that this is a norm, but this is one extreme. So this being the scenario, it is very, very difficult to tell when we are going to be able to practice and what we are all going to be able to practice. But giving a gist of the current scenario, just for the sake of the layman, the treatment treatment and the case intensities have been classified into emergency care, urgent care, and into scheduled care. Now, emergency care basically is any bleeding. Of course, I don't think anybody has done any extraction in the past 2-3 weeks since the lockdown has been in effect. But anywhere that it has been done by chance. So, emergency care or bleeding of in the extraction socket or bleeding anywhere intraorally can be classified as a emergency care. And then any diffuse swelling anywhere in the body, anywhere in the orificial place, that is again emergency care. And this diffuse swelling which might lead to airway obstruction, difficulty in breathing. So these things can be treated as emergency care. And trauma, though not many people are going venturing outside, but still trauma can happen. Somebody can fall in the house also, God forbid. But then that is again treated as emergency care. And other emergency cares will be like supposing prosthesis, removable partial denture, has got broken and embedded into any of this area causing pain, or even an orthodontic brace which is sticking onto the lip, causing pain. So that is also an emergency care. So these are emergency cares. Now the latter two may be that particular patient who has got a problem can contact his doctor, and the doctor, under extreme precautions, which I will tell you, can come over and do the required treatment in that particular care. Bleeding and other things, if the doctor is always contact your doctor, and generally knowing the severity or intensity of the issue, the doctor can either advise over the phone itself, or the doctor will refer you to an emergency care unit in a hospital. Or maybe the doctor can see you also. Now, when a doctor sees you, I will just talk to you. The next part is the urgent care. The urgent care is where the patient is having a lot of pain because of a tooth cavity. So the cavity has been probably left alone, or it has started recently, and then the tooth has broken off, and it is causing pain. So that is the urgent care. So in such situations, what we have been advised to do is not use aerosols. Our drill, what you know very well, and just for the sake of our layman, our drill is going to generate a lot of aerosols, because air is going to come at a good pressure, and then it is going to go into the mouth and generate aerosols. Though this particular person might not be infected, okay, so the person from the previous treatment might have an infection, or the aerosol in the atmosphere which is there, it is like air, can be sitting on the doctor's hand also, and it doesn't fly, but it can go into the oral cavity. So you need to be a lot of uh, exert a lot of care and ensure that aerosol is not going to go and be generated. So in such situations, what we are currently doing is we are only prescribing antibiotics. We are just having painkillers and antibiotics. And the worst case scenario, if the doctor feels that he has a setup where he can do the extraction by himself, it is done in his setup, or referred to again a bigger hospital wherein the tooth can be extracted. Unfortunately, it might have to be extracted if the pain is too much, and then a replacement later with an implant. But of course, in the earlier scenario, this used to be a root canal treatment. When you open a root canal, a certain amount of aerosol is generated. So you need to be a little bit careful about opening the root canal. Although I have been hearing or listening to a couple of other dentists who say that the root canal can be finished in one visit, but still, I personally am not for generating the aerosol in the clinic, not doing it. So these are certain urgent care things which are there, and the scheduled visits are always scheduled, so they are not in much of emergency work. Now, I said when a patient goes to does or has the necessity to walk into a dental clinic, what is the scenario there? Um, the dentist should be well equipped from the patient's point of view. He should be able to have a wash basin outside the entrance itself, wash hands, and then the dentist, in my opinion, should also give a mouth mask to the patient. So the patient walks in, and then, if possible, wear gloves also. And I also feel that if it is feasible, give a personal protection suit for the patient also, so that they don't touch anything, and even the feet also has to be covered up. Now all these things are going to cost. We will discuss about the cost factors later. And then once you're inside the operatory, once you're sitting with the dentist attending to you, again the dentist has to take sufficient care to reduce the amount of aerosol from happening. And before getting into that, again at the reception itself, the dentist should do a brief case history, whether you have traveled anywhere or anybody else whom you know has not been well, and then take the temperature by himself in the operatory. And once that is done, then always better to brush the teeth. The dentist can provide a fresh toothpaste and a fresh brush, brushing the teeth, and then washing with povidone iodine or sodium hypochlorite less than 1%, 0.5 to 0.8% sodium hypochlorite, rinsing the mouth, and then finally the dentist can see. The dentist will know what work or what precautions he is going to do, but then still the patient, I would suggest, take these certain precautions and ensure that the dentist is following. Because if you are not aware of it, and if by chance any of these steps are skipped, then it is a little bit scary, or you have to be a little bit concerned about it. And also ensure that your dentist is using disposable mouth mirror probe and tweezers. So this is also an important thing. So this will be during this current crisis. Now, once the crisis is over, um, what is going to happen is a little bit, when we are going to start, is a little bit tough thing to tell. We can't really be sure when we can start full-fledged, like the way we are doing in February or first half of March. Uh, Again, depending on the intensity, even if there is that one patient who has got infected, who is infected, we all know that he can spread it to 2.5 people in one day. Possibility. It can be more also. So the 2.5 people, again, it is going to multiply. So a lot of extreme care has to be taken by the dentist and by the patient also.
So considering, sir, there is a possibility of patients being carriers once the critical situation passes off. The
If
possibility of
I can just stop this one. The patients also can be carriers. The dentist also can be a carrier. So it can happen. You can collect it, you can send it. So the dentist from his point of view should not be a collection point and then distribution point. He should not be a C and F agent. Uh, he should ensure that C doesn't happen and F also should never happen. So it's not only the patient, even the dentist can be a C and F agent.
So, sir, considering at some point in time after the lockdown is over, the government gives us a official permission that dental treatment procedures can be resumed. That is whenever it happens, because even we don't know when that will happen. So once that happens, then the requirement for the dentist to upgrade his entire protocols, whether it is patient history collection protocols, or it be sterilization protocols, or say in between patient scheduling protocols, all these have to be changed. There has to be a total revamp that happens into the entire system. So what do you think the kind of changes would be enforced?
I will take your question in two parts, my thinking. First, you said government gives go ahead. Now, when the government gives go ahead and do your dentistry work, uh, then it is generally go ahead. They would have given riders by themselves. But then the dentist, like I got a call today morning from one of my old patients saying that my daughter is in pain and what do I do about it? So of course she had a wisdom tooth issue, so I could prescribe. I've done something right now with medication. I hope it subsides. I told them to call me back in the evening. So like this, we keep receiving calls. So we will be under pressure to start earlier. So before the government tells us to go ahead completely. Though I feel that we can start going ahead only when there is zero cases around the world. The number of cases around the world should be zero. Now we are aware again. Now they're again saying China, South Korea. There are again people who have got reinfected, and the infection has started again. So whenever that happens, only it is going to take a little bit of time before the government is going to give us our go ahead. Um, at this current scenario, considering that there is going to be a lot of load, So, like I said, the dentist may use his prudence and start off a little bit earlier. And then when he does start off, then it is going to be like this. So at the entrance itself, the patient is going to, same thing what I told you, the patient is going to be asked to wash hands and then be given a mouth mask. And then the details of the patients are recorded at the reception. It must include the contact details of all patients for further surveillance of contact tracing if it is required. And then if the patient requires dental treatment procedures, then the receptionist will provide him with a triple layer surgical mouth mask and a toothbrush. So this is going to be there. And patients should be directed to leave all their bags outside itself at a prescribed area and don a surgical mask and put a shoe cover and also use a disposable patient cap. Following this, the patient should perform hand sanitization using a hand sanitizer. And then he will be directed to a screening area where will be directed by the dental assistant to wash his hands, face, and brush his teeth. Brushing his teeth can be done with a toothpaste or without a toothpaste also, and rinse his mouth with antiseptic mouthwash in that particular designated area. And then the patient is examined by the dental doctor. The dentist will ascertain the nature of the dental problem and he will assign the patient to one of his operatories. So only disposable mouth mirror, rope, and the tweezer and any other thing are used. They should not be reused once again. So this is again very important. And when the patient is sitting on a dental chair, the patient is draped with an adequate uh, uh, personal protection equipment, and then is made to carry a pre-procedural mouth rinse with 1% hydrogen peroxide or 2% povidone iodine. So this is done, and the dental assistant ensures that the least aerosolization of fluids occurs while the doctor carries out the treatment. So this has to be done by the doctor. He is going to take care of this. And then the dentist, from his point of sight, he is going to ensure that he is adequately protected. He is going to wear an N95 mask, he's going to have a headgear, he's going to have an eye gear, and is going to have gloves, and he's going to have his personal protection equipment. And there should not be any kind of a area, your skin visible outside, which can be taken out. So after the patient, at this point of time, we have other precautions which we are going to use, like a dentist is going to use a rubber dam and few other things and disposables. And even the aerosol collector, there is a separate suction which is going to be used. All these are going to be quite expensive. It is going to be expensive. And so the patient gets, once the patient treatment is done and the patient gets off the chair, he should ensure that all the surfaces that he has touched, just from the point of view of the patient, he has touched, should be cleaned up in front of him itself by the assistant, which it will usually be done. That will be the standard protocol. But just for the safety, maybe the next person who's going to come inside. And then whatever caps that the patient is wearing, mouth mask, disposables, they have to be put out in a designated area. So once the patient leaves the place, the dentist is going to try to fumigate the area. There is some talk about, people are using sodium hypochlorite. So there is a hydroxy hypochlorite, which there is some talk about. So we don't know how it is going to continue. So let's hope for the best. So this is going to be a large procedure. Treating a patient for 5 to 10 minutes will require at least about half an hour's preparation. So it is going to be a tough thing if you are going to ensure that there is absolutely no passing out of the virus and ensuring that the virus is not hanging out anywhere in the air. Because we know when we cough, it goes up. So the fan that is there or the air conditioner that is there can keep it up and can pick it up and then start circulating it around. So all those circulations also should be again antibacterialized and antiviralized, sanitized. It's a tough thing.
So, sir, there are so many extra precautions that will come into play, but probably this is going to kind of become a norm in the future, because we don't know how other infections or other viruses and bacteria are going to act. So what exactly, sir, will be the financial implications of this to the dentist and to the patient?
Financial implications is going to be quite heavy. Of course, what happens to the dentist will have to be there. It's finally always the end user who's going to pay for it. That there is no thoughts or second thoughts about it. I have been seeing PPEs being sold at 198 rupees for each PPE. Yesterday, one of the traders quoted 598 rupees for his PPE. So, of course, this is a 90 GSM PPE, and it is more standardized. It is from a well-known company. So, but it is costing 598 rupees or 600 rupees, and you need two of them, one for the dentist and one for the assistant. And you need to use disposable masks, and you need to use disposable mouth mirror, probe, and tweezer. So, and then there's going to be a lot of sterilization procedure. I feel just the bottom line cost is going to be an additional 1,500 to 2,000 rupees for each patient. So if the patient is, and for each visit, not for each patient. If we are charging, let us say, 4,000-5,000 rupees for a root canal, and the root canal is for 2 visits, then it is going to be a 2,000 rupees extra for just the build-up. Otherwise, the dentist will have to sit and finish the root canal in within the first visit itself. But then we come across a lot of people who have different perceptions of pain and fear, and those people again will have to have a lot of, because we take a lot of time for these kind of patients, and they can't, and there are people who can't sit for more than 15 minutes, 20 minutes on the chair. So those are things which it's a tough thing. It is unforeseen, it is unprecedented, it's a tough thing.
But sir, nonetheless, end of the day, safety of the community is important, because we all belong to the same community. Whether they are dentists or they are patients, end of the day, we live in the same community, and their safety is as important as our safety.
Absolutely.
So I think a small price for everybody's safety is worth it.
Absolutely. Even any one life that can be saved should be saved. It is most important. See, as a doctor, I have many patients. Okay. For that patient, I am the only doctor. You understand? So that patient is going to look at me and hope to that I will. For me, it is one patient goes, another patient comes. It is for that patient, it is one doctor. There is no second doctor. So that is the kind of responsibility which a dentist will have.
Yes, sir.
And that is what he is going to try to do his best for his patient. So the patients have to cooperate also.
Yes,
it is going to be difficult. Considering our socioeconomic status in our country, it is definitely going to be difficult for a dental practice.
Sir, they were such useful insights that you gave into how dental practice situation would be post-COVID. I hope our patients get to understand the severity of the situation now, and the kind of measures as we dentists, being an integral part of the entire healthcare system, are taking or will be taking in the future to ensure the safety of the entire community.
Yep. Some of these tips, I must say, have been put across by the Armed Dental Corps of our Indian Army. So that is my source. I just want you to be aware of that also.
Sure, sir. Sure, sir. Thank you so much, sir, for joining me today. And I hope I'll be able to bring you back on this Tooth Talk conversation for
It is
another
always my privilege. Thank you for having me. Always my privilege. I would love to share my knowledge with my friends, both among the dental fraternity and amongst the common people. Thank you so much, Rekha. Appreciate the excellent work that you are doing.
Thank you, sir. Thank you so much. Thank you for all your support, sir.
Thank you, Rekha.
So, viewers, that was Dr. Ravindra Savadi, who did talk to us about the change in the setup in our entire dental treatment centers post COVID. I hope that talk was helpful to you all. And in case you have any doubts or queries, please write your concerns to us in the comment section below, and we will get back to you on that. And I will also attach the list of dentists in the description box below. So if you feel you need to contact any dentist in an emergency, you can reach out to them. For more information about your oral and dental health, do visit our website www.thedentaire.com. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, and Telegram. And until next time that I come back with another dentist with another topic on your oral and dental health, keep smiling, be happy, and stay safe. Thank you.